everyone, and welcome back to Low Income Relief. Let me ask you something. How many of you feel like Medicare is just getting more confusing every year? If you agree with me, you're definitely not alone. That's why we're here today. I'm hoping to break down some important updates coming in 2025 in a way that is hopefully very easy to understand. So here's how we're going to do this. We're going to start with how your costs are changing. And then we're going to look at some updates to coverage. And then finally, I'll share some practical tips to help you get through all of this. So let's dive in. I know that healthcare costs are a big concern for many of you. We have talked about this for a long time on this channel, how we get those COLA increases and it looks like things are going to get better and then premiums go up and things go up and kind of eat those things up. And I hate that. And I hate being the bearer of bad news. But Medicare is going to get more expensive in the new year unless you meet some low income requirements. And we're going to talk about that low income loophole a little later. But for now, let's just look at what CMS announced for the new price increases. So we'll start with Medicare Part A. That's mainly for your hospital care. The Part A deductible is going up from $1,632 to $1,676. That's the amount that you'll pay for the first 60 days of your hospital stay. If you have to stay more than 60 days, you'll have to pay $419 a day through day 90. That's an increase from the $408 it was before. And of course, after day 90, Medicare doesn't pay anything after 90 days. Part B pays for all of the other important things like doctor's visits, checkups, some home health care, Medicare equipment, outpatient services, things like that. The Part B premiums are going up by about $10 a month in the new year. So instead of $174.70, those premiums will now be $185. And of course, before Part B really even kicks in and starts paying for things, you have to meet your deductible. And unfortunately, this deductible is also going up from $240 to $257. It's not necessarily a huge jump, but I know every dollar counts when you're trying to get by these days. So the important thing is to keep an eye on your mail because Medicare will be sending out letters to everyone in December. This letter will clearly show your new Part B premium for 2025 and all of the other important details about your costs. Now, if you're worried about these numbers, please stick around because we're going to talk about a special program that could help take care of those out-of-pocket costs for you. And I don't want you to miss that information. But before we get into that, I think this next part is really interesting because even though Medicare is going to be charging you more, they're also going to be paying your doctors less. I know that sounds kind of backwards, right? So basically, in their new press release, Medicare made it clear that the rates for how much they pay doctors for different services in 2025 will be changing. And those rates are going to go down by about 2.93% overall. Now, this is because Congress did not approve any price increases. That was set at 0. But there is a temporary boost that is expiring. So that temporary uplift that they had is going away. Now, hopefully this particular change won't affect you at all, but some people have speculated that it may become harder to find a doctor who's willing to accept new Medicare patients, or you may notice that your appointment times become a little shorter as doctors try to fit more patients into their schedule to make up for that budget shortfall. Hopefully that doesn't happen, but if it does, I wanted you to kind of have some context as to why. And of course, unfortunately, the bad news doesn't stop there. We need to talk for a minute about telehealth. And I don't know about you guys, but I absolutely love telehealth. I rely on it all of the time, and it's so nice to be able to connect with a doctor without having to leave the comfort of my home. And I know a lot of you have probably really enjoyed that convenience too. So I'd love to hear your thoughts on telehealth in the comments. Now, Medicare made it a lot easier to use telehealth during the pandemic, but unfortunately, some of those rules are changing back now. Telehealth is not going away completely, but it's not going to be as flexible as it has been over the last several years. For example, you might not be able to have a telehealth appointment from just anywhere anymore. There could be restrictions on where you can access it and who can provide it and under what circumstances telehealth can be used. Ultimately, this could mean that you have to travel to the office to visit your providers more often. But the good news is that some telehealth services are here to stay. Caregiving help and counseling for certain conditions will still be available. And they even said that you can meet with your doctor over the phone with a basic phone call for some services if you don't have access to video. So I know that overall this might be disappointing for some of you who really liked the convenience of telehealth, but I wanted to make sure that you knew about these changes so you could plan ahead. Now, I did find some good news as I was reading through all these press releases and announcements, but they appear to only apply to people with certain medical conditions. For example, CMS is finalizing new coding and payments plans and things for FDA-cleared digital mental health devices, which is awesome. I know that this country really struggles with mental health services, so anything we can do to make that more accessible is great. And another thing that I noticed is that they're even expanding access to dental care for certain patients. So you probably know that Medicare usually doesn't cover dental services like cleanings or fillings or dentures, but they are starting to cover certain dental services when they are inextricably tied to certain covered healthcare issues. This means that the dental care must be absolutely necessary for treating another medical condition that Medicare already covers. For example, if you're undergoing dialysis for kidney disease, Medicare may now pay for specific dental treatments to make sure that your mouth stays healthy. Now, why would they do that? Because infections or dental problems can cause serious complications if you're also undergoing dialysis. So this change could make a real difference for anyone who is dealing with these specific medical conditions that this applies to. I know it's not full dental coverage yet, but it is progress, and it shows that Medicare is starting to pay more attention to how dental care impacts your overall health, which is certainly great. It's always drove me nuts that healthcare and dental care aren't related because, dental pain can be so debilitating, and it can affect your health in so many ways. But before we dive into that tangent, I just want to let you guys know, I realize that a lot of the changes that we've discussed today are great. They certainly aren't what we hoped for. Rising costs, decreasing payment rates, the loss of easy-to-access telehealth, and these are not the sort of things that I like to bring to you. I like to bring to you more optimistic and helpful and hopeful things. But this next update may be able to help you, especially if you're on a low income. So it turns out that about 1 in 8 Medicare beneficiaries are enrolled in the QMB program. But studies show also that only about half of eligible people are actively enrolled in this. QMB stands for Qualified Medicare Beneficiary, and this program is honestly amazing because it can eliminate most, if not all, of your out-of-pocket Medicare expenses. Now, if you haven't heard about QMB before, this rule protects certain eligible low-income Americans from having to pay medical bills that they can't afford. This is a huge help for low-income Americans because, not a lot of people know that this program exists, but it can cut some of those costs for you. There's actually been some issues with providers and debt collectors trying to charge QMB eligible people who shouldn't have to pay those bills. So CMS recently released a statement about it, and I want to read to you part of this press release. They said, quote, "Today, the Consumer Financial Protection Bureau and the Centers for Medicare and Medicaid Services issued a joint statement to protect millions of people with Medicare living at or below the poverty line from unlawful medical bills. These people in the qualified Medicare beneficiary group represent about 1 in 8 Medicare recipients nationwide. Federal law generally prohibits healthcare providers who accept Medicare from billing these people, referred to as QMBs, for cost sharing such as copays or deductibles," end quote. Now, this is really exciting to me because I hear from a lot of you who are on Medicare and are frustrated at the high costs that you have to pay to access that care. So I'm hoping that a lot of you may be eligible for this. So I just want to make really, really clear what this program is. On the CMS website, it says, quote, "Federal law forbids Medicare providers and suppliers, including pharmacies, from billing people in the QMB program for Medicare cost sharing. Medicare beneficiaries enrolled in the QMB program have no legal obligation to pay Medicare Part A or Part B deductibles, coinsurance, or copays for any Medicare-covered items and services," end quote. So, sorry, I'm really excited about this. I'm hoping this is going to help you guys out. So if you're eligible for the QMB program, it can cover a lot of your out-of-pocket expenses. You just need to be enrolled in Medicare Part A, meet income limits and asset limits to qualify. For 2025, those limits are going to be $1,275 a month for a single person or $1,724 a month for a couple in most states. Now, as usual, those rates are going to be higher in places like Alaska or Hawaii, where the cost of living is substantially higher. Now, if you qualify for this, you need to reach out to your state's Medicaid office right away to apply. QMB is part of Medicaid, but you don't have to be enrolled in Medicaid. You do need to be enrolled in Medicare Part A, though. So here's what you need to do. You need to find your state's Medicaid office. You need to call them or visit their website to see if you can apply for QMB online. You need to be prepared to provide documentation. You may need to provide proof of income or assets in order to complete your application. Once your application is approved and you're enrolled in QMB, you need to let your medical providers know so that they don't bill you for costs that you are not responsible to pay. Unfortunately, you may still get some bills along the way because here's the thing. Federal law says that they can't bill you, but that doesn't mean that healthcare providers always listen or that they never make mistakes, right? So sometimes people enrolled in QMB receive bills or even debt collection letters for bills that they should never have owed in the first place. Now, if that happens, there's things you can do about that. Both the CMS and the Consumer Financial Protection Bureau have made it clear that healthcare providers can face sanctions or legal penalties for improperly billing QMBs. Debt collectors cannot collect on those debts or report them on your credit either. So once you're enrolled in QMB, you just need to let those providers know when you get a bill. If you get a bill from a debt collector, let them know you're a QMB. If they don't take care of that for you, you can complain to Medicare or the Consumer Financial Protection Bureau. And if you have paid an improper bill you didn't owe, you may even be entitled to get that money back. In fact, the rules say that even if a provider was given incorrect information about your QMB status, say by a Medicare Advantage plan, they are still required to refund any improper charges. So watch out for that. And while you're watching out for that, make sure to stay vigilant for scams too. The FTC recently announced that scammers are actively making phone calls pretending to be from Medicare. They can even spoof caller IDs so that it looks like the call is coming from Medicare's name and number. They are very sophisticated. These scammers will tell you that they need your Medicare number or your bank account number to issue your new Medicare card, but that is not how this works. That is not true. The cards that Medicare sends are mailed automatically for free. You should never give your Medicare number or your bank account number to anyone who calls you out of the blue, no matter who they claim to be or what your caller ID says. The government encourages anyone who suspects that they may have been the target of fraud to call 1-800-MEDICARE and report that right away. You need to keep yourself safe. Now that's all I have for you today in this video, but don't forget to check out our other videos for more ways to save money and get free stuff. And don't forget to pop over to our secondary channel at Fast Facts by Low Income Relief for our next video, which should be starting in just a few minutes. I'll see you there.